I'm Paige, I'm a student nurse, and I'm going to be administering medication via mini bag. So I'm just going to review. I have Dory Dabney, born October 3rd, 1996. She has she's been admitted with cellulitis of the left arm, so we're going to be giving her an antibiotic to treat that. And I've already checked the physician's order against the MAR, so everything's good. She does have a normal saline running at 25 mils per hour in her room already. So I'm just gonna do a first check now. So I'm washing my hands, and I've already grabbed my medication from the Pyxis machine. So I have Dory Dabney, and also she is allergic to morphine. So yeah, allergic to morphine. Cloxacillin dose is 1 gram. We have a 2 gram vial, so we have enough to draw out. It's an IV medication, and it's due today and now at 0600 and every 6 hours, and it has not been given. I'm just going to review the drug monograph now. So cloxacillin, it's an antibiotic. It can be administered by nurse or student nurse. Usual dose is 1 to 2 grams every 4 to 6 hours, so we're good with that. Under the maximum single dose of 2 grams, under the maximum daily dose. It does need to be reconstituted, and since we have a 2 gram vial, I'll need to reconstitute it with 6.8 ml sterile water for final volume of 8 ml, final concentration 250 milligrams per amount. And then I'll further need to dilute it in 50 to 100 ml normal saline, which I have, and administer it over 30 to 60 minutes. I'm going to choose 60. I have checked that it is compatible with the normal saline that's running in the patient's room already, and we're under the maximum rate and under the maximum concentration, and some potential hazards are possible diarrhea, nausea, and a hypersensitivity reaction. So now that I've reviewed that, I can start to prepare my medication. So reconstitute, so I'm washing my hands, I have my vials, sterile water, and the medication. I'm going to clean the top of each vial for 30 seconds, let dry for 15. Clean the top for 30 seconds, let dry for 15. So as per the drug monograph, for a 2 gram vial, I'll need to reconstitute with 6.8 ml sterile water. So I have a 10 ml syringe. Making sure I'm remaining sterile. So I'll draw back 6.8 mils of air to inject into the sterile water. Okay, so I'll draw back 6.8 mils. Okay, so I'll recap using the scoop method. Get out any bubbles. Make sure we're a little short. So my vial is still sterile. I'm just going to grab a little more. 6.8. Go. Recap using the scoop. Hit on any bubbles. That would be over a sink. So we have our 6.8 ml sterile water. So now I can inject it into the medication vial, which has already been cleaned. So I'll inject. Okay, I'll recap using scoop. And this can go into sharps. I'm going to gently rotate the vial just to make sure the medication's dispersed, there's no sedimentation, so that's all good. I'm going to re-clean the vial just in case I contaminated it again. And so now that I've reconstituted, I have a final concentration of 250 milligrams per ml, and then I would take my syringe, and I've calculated that I need to pull up 4 milliliters to get the 1 gram dose, so I'll pull back 4 milliliters of air. This has already been cleaned. And then I'll draw back 4 milliliters. Okay. Recap using scoop. Get out any bubbles. And I would be over a sink just in case any drips over. And then we have our 4 ml dose. So now that I have my dose, I can do a second check. So I have my label that I've already completed, medication, and my mini bag. So we have Dory-Dabney, Cloxacillin. It's a 1 gram dose. Per my calculation, I needed to draw up 4 milliliters. I have 4 milliliters, which equals the 1 gram dose. And I'm further diluting it in a 50 ml normal saline. 50 ml normal saline, I'm choosing 50 ml just because the patient doesn't need any extra fluids, and I'm administering it over 60 minutes, so I have time in case an adverse reaction does happen. So it's an IV medication. Due now, 0600, and it's signed. Okay? So now I can go ahead and inject it into my mini bag. So I'm just going to clean the port for 30 seconds. And then remaining sterile. I'm going to inject the medication. Recap using scoop. Now this can go to sharps. I'm going to gently rotate the bag to make sure the medication is dispersed. And I'll attach my label just on the back, making sure it's not covering any important information. Okay, so now that I've done my second check, I'm ready to go to the patient's bedside. I have my secondary tubing, alcohol swabs, pen, and my medication. So as I'm entering the patient's room, I'm doing a safety check. I'm gonna do hand hygiene. And okay, hi, I'm gonna be your student nurse today. I'm just gonna take a peek at your wristband here, and can I get you to state your first and last name? Okay, perfect. And your date of birth? October 13, 1996. Okay, perfect. And do you have any allergies? Morphine? Okay, perfect. So now I'm just going to do one last third check. So I have Dory-Dabney, Cloxacillin, 1 gram, which was 4 mils that we drew up and injected into a 50 ml normal saline mini bag. For a final volume of 54 mils. It's an IV medication, and it's due now today at 0600 and it hasn't been given. So now I'm just going to do, I'll just let you know about your medication. So it's Cloxacillin. It's an antibiotic to help treat your cellulitis. Some side effects you might experience are nausea, diarrhea, and possible hypersensitivity reactions, so I'll be monitoring for that. And now the patient would have the right to refuse. She hasn't refused, so we're good to go. Yeah, hand hygiene is done. So I'm going to now lower the primary bag, and as I'm doing that, I'm just making sure it's the correct solution running at the correct rate. And I'm just checking the line, making sure it's patent, it's running, checking the IV site for any redness, swelling, irritation. Do you have any pain? No, there's no pain. Okay, so now I can attach my medication. So now I would label my tubing with the date, time, and my signature, and remaining sterile. You can spike the bag and making sure it's clamped. So I'm going to hang it here for now while I attach it to the port. I'm going to attach it to the port just above the pump. And I'll clean for 30 seconds, let dry for 15. Keeping sterile. I'll attach. Okay. So now that I've attached, I'm going to back prime. So I'm going to lower the mini bag. I'll unclamp and make sure all of the air has been removed from the tubing and the drip chamber is about half full. So that looks good. I'll reclamp. And now I can go and set my rate. So I have my calculations here. So I'm going to hit stop primary. I'm going to hit secondary. My rate is 54 mils per hour. 54 mils per hour. And my volume is 54 mils total. And then confirm secondary. And I'll press start as I'm unclamping the line. Okay, and I'm just making sure that 3 drips have gone through. And I'm gonna come back once the medication has gone through, so in about an hour, and I'll program in a 15cc flush, and I'll be back to monitor for any signs and symptoms, and then I'll do a safety check as I walk out, and then I'm leaving the room to document on the MAR and the fluid balance record sheet. I'm doing safety check as I walk out.